This video demo is to show how to utilize the behavioral health practice management workflow. Here we'll make a new chart. In the patient demographics, I'm going to populate the patient information and insurance information. Now I'm going to save this chart and return to the chart room. Let's make an appointment for our patient. Our new patient would like to be seen today. To create an appointment, simply double-click on the screen and fill in the event details. This patient has confirmed their appointment, and we're going to save. Once the patient has arrived, you'll double-click on the appointment to open it. You'll mark this patient as attended, and you can collect their copay from the appointment screen. A new payment field will appear with the copayment details pre-populated. Simply select the source of payment and click Done. Now you can save your appointment. And if you are the provider using the calendar to document this information, you can actually create a note from this screen and select the note type. The type of provider you are determines what version of the assessment that you will be able to view. This is the prescriber version, the non-prescriber version, and the nursing version of the assessment. To document the information within the appropriate assessment, you'll have a list of buttons on the left that comes standard with the program, a free text field here in the center where you can populate any additional detail pertinent to this patient, and custom buttons on the right that you can generate to make the program your own. Here I'm going to come over to patient has symptoms of, and I'll go to depression. This will bring us to the depression shrub. I'm going to work left to right across the screen, clicking these buttons to populate detail here into my note. If you make an error, you can simply click into the field and remove that text. Then return to the left-hand side and continue to work down and left to right. Once you have completed your documentation, click the back button to return to the previous screen. Our program does save every keystroke. There's also a red X letting you know what fields that you've accessed and documented it in. Continue filling in the appropriate information. Once the provider has worked through the tabs, you'll come to the Finish Initial tab, and you'll see some of the populated data, such as the medications, the diagnosis, and the CPT code. Once this note has been completed, you'll click Compile this note to aggregate all that data into one comprehensive document. You'll see here on the left, it'll have the provider's name, the letterhead, the patient information, and the note title. Down below, you can see the actual text of the note that was created by generating buttons with minimal typing. Here we'll spell check our note, and then we can sign it electronically. Now we'll move to the billing portion of the program. Here we're going to go to our reports. In the billing productivity report, all you have to do to generate this once you have your default search set is pull up a range of dates, clear your patient filters, and if you're billing for all providers in all locations, simply clear those filters as well. Here we're going to go to the billing report, expanded, and it'll tell us that we have one encounter and one is ready to submit. Those that are ready to go will have a green light there for you to let you know that you have all of the basic required billing fields required to submit your claim. At this point, you simply need to prep and submit those in order to send those to your integrated clearinghouse. Once the claims have been processed by the payer and returned to the clearinghouse, we will then pull in those remittances back into ICANotes every evening into the patient accounts portion of the program. Here you can see a list of the imported remittances on the left and the ICANotes service charges on the right. These are matched up remittances, so they link up and they're going to be posted appropriately to the correct account. It will apply the billed amount, allowed amount, paid amount, contractual adjustment, and patient responsibilities. To post these, simply click Post Match Payments and click OK. Once those have been posted to the account, they will turn green. If you need to view any additional information, you can show details and show payers. From here, we can access the patient's account. If the patient owes any kind of balance, you can then go to our Statements tab to generate a statement to send to the patient. And that's the behavioral health practice management workflow. Thank you.